Now, the Washington Post recently wrote a great story that illustrates the disastrous state of healthcare in America. So it involves the University of Virginia health system. So now UVA has been suing people for medical bills, and they've been suing a lot of people. Now, this piece, of course, focuses uh, a little bit on several families, of course, who have been through some of these lawsuits, has basically lost everything, but also goes into why they're doing what they're doing and the disastrous impact that it has. So now let me give you an example. The Waldron family, who was mentioned in this piece, they were sued by the University of Virginia Health in order to recoup about $164,000 in charges for an emergency surgery performed in 2017. Now, $164,000. That is an expensive surgery, but it was a necessary slash life saving surgery. That's why, of course, it was necessary. So now that's only one such lawsuit. Over the last 6 years, ending in June 2018, the Washington Post explains, the health system and its doctors sued former patients more than 36,000 times for over $106 million. They seized wages, bank accounts, put liens on property and homes, forcing families into bankruptcy. This is according to stats quoted by the Kaiser Health News Analysis. So now I realize I've got some foreign viewers that watch, right? So people from different countries, Denmark, Germany, etc. And so if you're from a different country, you're scratching your head thinking, wait a minute, medical bankruptcy, what is that? What is that? And what it is it's basically an American only problem. We're the only country in the world or in the industrialized world that allows people to go bankrupt due to medical bills. And, you know, while this happens a lot in America, unfortunately, UVA stands out for the scope of its collection efforts. So now, the Post explains how they persistently go after payment. They pursue both poor as well as middle class patients for about as much as they're worth. Some examples of that include UVA suing patients for as little as $13.91 and as much as $1 million dollars during that same period, up until about July 2017, when it restricted lawsuits to those owing more than $1,000, according to this analysis. If that's not bad enough, every year the health system also sued about 100 of its own employees, who also happen to be patients at UVA, garnishing thousands of paychecks, largely from workers at lower pay employees, such as Walmart, where UVA took wages more than 800 times. Now, already, if you're working at Walmart, chances are, management, you're not doing very well. And so here comes UVA. And by the way, Walmart pays low wages, and it also encourages people to get on Medicaid. So, and the people that make too much for Medicaid, or where Medicaid has not been expanded, they're not able to get health care. They're not able to afford health care. And if they go to UVA and rack up some pretty expensive bills, $10,000, $20,000 worth of medical bills, UVA will take them to court and garnish their wages even further. It's an absolute disaster. Now, under a Virginia program, and they're able to do this because of a Virginia program designed to help state and local governments collect debt. It seized $22 million dollars in tax refunds to patients with outstanding medical bills in the last 6 fiscal years, most of it without court judgments, according to health system spokesman Eric Swenson. They also filed thousands of property liens all the way to Georgia, so all the surrounding area. Now, UVA also hit former patients with an additional 15% for legal costs plus 6% interest on unpaid bills. That adds up sometimes to be larger than the original bill itself. So now some of you might be asking, look, I understand that, right? But maybe there's some sort of help for people, financial assistance, especially if you're low income. Well, yes and no. Now, the Post explains that the health system does have programs there to help people who are poor, but it actually has the most restrictive eligibility guidelines for financial assistance to patients of any major hospital system in Virginia, according to interviews and written policies. Savings of only $4,000 in a retirement account can be enough to disqualify a family from aid, even if its income is barely above the poverty level. So now here's the amazing thing about this story. Now you might think of it and think, okay, this has got to be a for-profit hospital, right? No, it's entirely state and state funded and taxpayer supported. This is not a for-profit hospital, it's a nonprofit. It also pays no federal, state, or local taxes on the presumption that it will offer charity care. Now, you know who sits on its board? Governor Ralph Northam, who's a Democrat. So that nonprofit run by a Democrat. So now the hospital, in response to all these lawsuits and people going, hey, why are you suing so many people and recouping so many money from people who can't afford to pay? They say that look, we need to, in order to allow our hospital to continue to run. And they point to the Virginia Debt Collection Act of 1988. That requires state agencies to aggressively collect any sort of money owed. So again, here's the problem, right? They're forced to collect that money owed to pay for their operating costs. Now that makes sense, right? You look at the context. Okay, that makes sense. That's taxpayer money. They're just trying to get it back, right? But at the same time, the reasons that people cannot afford to pay those bills is not because they don't want to pay them. It's because they can't afford to pay them. They don't have the money, even and because our health insurance system is completely and totally broken. People cannot pay either because they're uninsured or they have short-term coverage, these so-called junk plans that do not pay for treatment or for some pre-existing conditions. Or they happen to be out of network, or they end up having a high deductible plan as high as $6,000, which you have to pay first out of pocket in order to have your health insurance kick in. Patients also have trouble because, like many U.S. hospitals, UVA bills people on lacking coverage at rates far higher than what insurance companies pay on behalf of their members. And a lot of people don't actually know that. Such bills, they say, have little connection to the cost of care. Experts say insurers obtain huge discounts off hospital sticker prices, 70% on average in UVA's case, according to documents it files with Medicare. Now, this hospital gives out great discounts, but if you just don't happen to be covered, you can't afford insurance or pay your deductibles, you're not going to get that big discount. UVA offers uninsured patients up to 20% off to start and another 15% if they pay properly. Few are able to do that. In the case of Waldron, UVA sued her after she discovered her insurance had lapsed and she was unable to pay her bills. And that happens plenty of times as well. The $164,000 billed to her for intestinal surgery was more than twice what a commercial insurer would have paid for her care, according to benefits firm Well Rhythms, which analyzed bills for Kaiser Health News using cost reports UVA files with the government. Now, charges on her bill included $2,000 for a $20 feeding tube. So her insurance lapsed. She was charged not only double for her surgery, but also, 10 times what her feeding tube should cost? That is both broken and insane. Now, Waldron says, she's like, look, I'm thankful for the care that I got. I got really good care there. But at the same time, she said that UVA has, quote, ruined us. So now that's the problem, right? And UVA is just one of such hospitals that charge people. But again, they're getting pointed out for their uniquely harsh collection practices. But lots of hospital systems operate the similar way. And there are millions of people that are in medical debt and have to declare bankruptcy. They lose their homes. They lose their assets. Some have to end up getting divorces through financial issues and difficulties. And so it's an absolute disaster, and absolutely why we should have a Medicare for all single payer system. In that kind of system, hospital would get paid. They wouldn't end up having to charge $2,000 for a feeding tube because Medicare would be able to have. And look, the hospital itself has shown that yes, we will negotiate with insurance companies, and so they could negotiate a fair rate for the feeding tubes and for the anything they need. Now, again, I go back to that because that's one specific case, but there are plenty of discounts to be had if the hospital, if Medicare is allowed to negotiate with the hospital. Okay. So in a single payer system, like I said, the government could negotiate those deals, prevent litigation as well, and that would save a lot of money. And it would also not ruin people's lives. And that's what's going on here. I mean, think of the cost, by the way, of just taking these people to court who end up not being able to pay. A recent NPR report noted that nonprofit Mary Washington Healthcare in Fredericksburg, Virginia, had about 300 cases in court in 1 month. Another Virginia court was said to have handled about 300 UVA cases a week. So that is a lot of litigation. And the court proceedings are hugely stacked against patients who can't afford to pay. The Post explains, the health system sends collections representatives, not lawyers, who sit near the judge's bench. They give patients 2 weeks to commit to an interest-free payment plan, according to courtroom meetings witnessed by a reporter. Otherwise, quote, they say we're already going to be reviewing it for garnishment, a UVA official tells a car accident victim. Which, of course, look, so this is, again, a huge problem, right? And with bills, often in the tens of thousands of dollars, even those 5-year interest-free plans happen to be unaffordable, according to some of these patients. Those deadlines are imposed at least 150 to 200 days after they were sent their first bills, so long before they end up in the court system. Now, there was one person detailed in this story. There was a 70-year-old, right, who decided she was going to fight back. Now, she had uterine cancer and had signed an open-ended payment agreement for a previous medical bill that she had. So she went to court and she argued that the agreement that she had signed, by the way, while she was bleeding and in some serious mental distress, because that's mental and physical distress, because that's exactly when you want to sign these agreements, were vague. She said they were so vague as to be unenforceable. The judge did not agree. They ended up agreeing with UVA's lawyers, and they said she had the ability to decline the surgery if she didn't like the terms of the deal. Oh, that's nice. So that shows how the court system is stacked against you. Well, yeah, I mean, you decline life-saving surgery. You have the ability to do so. Okay, and then what? Then you die? That's the system that we have. Your money or your life. That is not a good system, as it's unconscionable. And again, why we need single-payer Medicare for all insurance. Everybody has to have insurance. Now, look, I urge you guys, this is only scratching the surface of this report. I urge you to read it. It's in the description of this video. These are heartbreaking stories, and it goes to detail in how there are so many different roadblocks in getting help to pay these massive bills. And it also shows how this system is completely broken. We need to fix this system because at the end of the day, nobody deserves to go into debt for healthcare. And healthcare itself should be a human right. Hey guys, hopefully you enjoyed that free video. Now I'm going to have to ask you a favor. Between the demonetization and the YouTube algorithm messing around with view counts, etc., we're having a hard time adjusting to the new YouTube reality, which is where you guys come in. See, we have a Patreon, patreon.com/TYTNation, set up to help us rely on you guys, the viewers, instead of big corporate ads. Look, you know the show. You know I'm not in favor of big corporations anyway. So help us transition away from relying on the ad model to pay the bills and sign up to be a patron, patreon.com/TYTNation. That goes a long way to help us keep the lights on. And you guys will know that you're supporting independent, progressive media.